And
Yep.
sometimes patients who have dizziness, when they move their neck certain ways and things, it's because they have, clogs, basically, right? In your pipes again. So this is clogs in your artery pipes. And maybe they need true vascular care from like a cardiology
Cardiology.
type specialist and that kind of group. And then I'm watching for that. So I should be listening and watching for that and not mistaking that for like what I'll call more joint or muscular related issues, right? So
Right.
as a clinician in the area of dizziness, you should always be thinking about these things and then seeing what fits and what does the person need. Now, does the person who has vascular issues might also have like tight joints in their neck? Sure. So like I can provide that care. I can't fix your vascular system. That's something that I'm going to refer for. And then
Right.
it's kind of this team approach. And, not every patient needs a bunch of team members. Some people only need one. Some people need like two,
Right.
so some people need four, and that's okay, depends on what's going on,
That's
right?
interesting. It's interesting because I'll tell you is when you go as a patient and you go into Google and you look up cervicogenic dizziness, you're probably going to run to a chiropractor, and you're
Yeah.
going to look on their website and they're like, "Yep, I can treat this that. You got tech neck, you got a straight military neck where it's like sure, yeah." And I'm tall. If you don't remember, I'm a big old guy,
Yeah.
and the world is not built for tall people, so I'm
No.
looking down. But I also know that people that have straight neck don't suffer or didn't suffer from the same symptoms I did. And I was like, I don't understand, why am I so lucky? Maybe, well, a lot of what you're saying is that it really wasn't my neck, right? And I kind of came to that kind of understanding myself, where it was like, you got to look elsewhere. And it was clear when I saw you there's other stuff. All right, so last question, recommendation, just so we can hear from you. You've seen enough patients. Is there anything you could recommend from us? I mean, we've talked about a lot, but anything you want to just recommend to people looking for either new to this sensation or experience with chronic or over the years, like me?
Yeah. I think anyone new or experienced, sadly experienced, with symptoms would be to be